The following portion of the Arizona Daily Mix is sponsored by Dr. Apachu.
March is Kidney Awareness Month, but kidney disease is something we should be talking about all the time. And here to shed some light on signs, risk, and how to manage kidney disease is Dr. Apachu. How are you, sir?
Good. How are you?
Good. This is such a good time to have you in here because we're looking at summertime, we're looking at kids, we're looking at adults being out and everything. And as we were talking before, one thing about kidney disease, and that is dehydration. And that is something that we need to start looking at, right, when it comes to signs.
For sure. Especially in Arizona, with the summer coming, I would say dehydration plays a huge role in getting your kidneys dehydrated. A lot of them are medications, which also cause dehydration. So definitely something that you really got to keep an eye on. March, like you said, is Awareness Month, but I would say every month should be a Kidney Awareness Month. Because people usually don't realize that their kidneys are not working well until it gets to about 20% or so.
Wow.
So usually when they find out about kidney diseases, the kidney disease is already very advanced. So definitely spreading awareness with kidney disease is crucial, especially in Arizona in the summers.
All right, so let's talk about signs to see if you do have a kidney disease or you're on your way to have a kidney disease. What's some things people should look at?
So, like I said, only after you get down to 20% or so is when you'll see the signs. And the usual signs would be fatigue, swelling in the legs. You can also see changes in urinary patterns. You can see if it progresses even further with toxin buildup, you can have somnolence, nausea, vomiting, and the last stages is going to be coma. You don't see that in the US, but probably see it in the third world countries. But definitely those would be the progression of the disease and the signs that you see along with it.
Yeah. Let's go to people at risk to get kidney disease, because I think we need to make sure we break some of the myths of that. Because one, everyone thinks it's going to be an older adult who is on medication or something like that. But we're also starting to see it in younger adults and kids too, right?
Correct, for sure, for sure. So the most common, like you said, is definitely adults. About 3 out of 4 patients who end up on dialysis is either because of diabetes or high blood pressure. And that's the root cause. The silent killers usually try to find out only when it causes end organ damage. So definitely those would be the big factors that cause kidney diseases.
Yeah.
But younger adults or young kids also have kidney problems, which are more intrinsic kidney problems because of inflammation, because of autoimmune diseases. So definitely routine screening for kids and adults is highly recommended to make sure you don't end up with advanced kidney disease.
Is a kidney stone considered a kidney disease, or is that, will that lead to kidney disease or anything like that?
It does. If it does cause obstruction for a long period of time, it does. Similar to prostate, where it causes obstructive uropathy, kidney stones, in large amounts. There's some stones called staghorn stones, which are really big stones, obstruct the kidney completely and cause damage just because of back pressure onto the kidneys, and it's caused obstructive uropathy.
So, okay, can you, this sounds kind of weird, but can you overwater your kidneys and get kidney disease? I know people drink a lot of water. Is that good or bad? Or?
Moderation is always better. You cannot overwater your kidneys if your kidneys are doing well. The kidneys realize that you have excess body water in you, and they basically excrete it out, pee it out.
Yeah.
But then if you do have kidney problems and the kidneys don't realize how much excess body water you have, then you end up having swelling. It can travel up from your legs all the way into the lungs. So conditions like that, congestive heart failure, kidney problems, I would not push the water too much if you already have swelling in your legs.
Yeah, and to watch it. Okay, let's talk about managing kidney disease. I think a lot of people, wonder, okay, maybe I have a relative have it, maybe I am, how do I manage it and make sure I stay on top of it and take care of this disease?
Sure. Yeah, so first would be a routine screening to find out, and it's very simple. All that you got to do is just a blood test, a kidney panel, and a urine study. Urine study basically will show blood or protein, but regular urine analysis will let you know, because urine is like the window to the kidneys, right? And that is what the kidneys put out. So if you do have inflammation inside the kidneys, you see it in terms of spilling blood, spilling protein, and a kidney panel will let you know if you do have kidney problems or not. And coming to management, usually, like I said, it depends on the cause of kidney problems.
Yeah.
So diabetes, high blood pressure should be really managed well. And then if it's any other intrinsic kidney problem, you need appropriate management for the cause of kidney disease. And if it's end stage, then people do end up going on dialysis with the different modalities. but definitely something that'll reduce your quality of life and so on. So definitely not going there is what we need to do.
Right, and that's prevention and taking care of, which is so important. So,
Exactly,
I love also too you work out in the rural area, out in Casa Grande, because you do know those people out there definitely need health care and to be risked. So, we thank you for doing that, and thanks for driving in. So,
All right, thank you so much.
Hang out right there,
Appreciate it.
Doctor.
All right,
We'll be back and talk more. If you want more information, of course, what we've been talking about, you can go over to the CW7AZ.com to find out all the information right there. Also, you saw it on the screen. So, thank you, Doctor.